aba eba Cmgh TV kasebo me amede kasebo ibremu edi ameje so wani Sika Beatrice yen hwe nsem bi a edi kasebo imu akotene pani a oda FDA ano e dia tudwa se eye COVID-19 edura e dia badwa so e ya de o ma hwehwem agye atum se eye Dr. Kwame Amponsa Achianu enso dia tudwa se COVID-19 edura aba abontin na ya di a na esi o mani so se o me de be magana ha ni na enso enipa 20 million edikan e na omonsa ebeka bi when in Sembia ekeka on yede som mo se Cmgh TV kasebo afi yen hwe kasebo yintremu pani a oda FDA no a ye frɛ no Mimidiles dakom e de atudwa o Ghana's vaccination rollout program say eye COVID-19 edura ye de aba abontin no e ya de a FDA fo atena se ahwehwem ehu se eye intino e magana fo embo hu.
Show you that the Food and Drugs Authority has used what we call the emergency use authorization pathway to authorize the two vaccines that we have at the moment. That is the Covishield, is the AstraZeneca Oxford vaccine manufactured by Serum Institute of India, and what you call the Sputnik V, which is manufactured by a company in Russia. Now, emergency use authorization is a pathway that we use. That pathway is just to ensure that a needed medical product, especially in a pandemic, is made available in a timely manner. So the only thing that is different in emergency use is that we do it quickly. We have not bypassed any safety or efficacy standards that we would normally look out for. We just ensure that we do it faster so that the product can be made available in a quick and timely manner. So just to assure you that all the things that we have to do to ensure that a vaccine or a medical product is safe, we have done for these two vaccines. As you were told, after the vaccine has been authorized, as with every other product, the safety has to be monitored. And we have put together a nationwide safety surveillance system. That is the same system that we use for all vaccines that are used in the country.
Dr. Yefreno Kwame Amponsa Achianu enso so de tudwa e wo Ghana's vaccination rollout program yase se na yo mani suade hu se Ghana fa na nyina omonsa beka COVID-19 eduro yi bi nanso so enipa 20 million people ene benya wo man mu na enipa 20 million yi omo a omu benya bi ne a doctor fo a nurse fo enipa omanyini abro 60 years ana se omo a omo wo yarewa bi wo mu nipaduamu ni ade omo na omonsa ebeka COVID-19 eduro yi.
There's a lot of pressure on the vaccines. The whole world is on the same manufacturers, and so we know that we will not get the vaccines en bloc for the entire population, and therefore it's going to come in trickles. And so we had to do a kind of segmentation in order to have effectiveness in delivery. So ultimately, the vision is to vaccinate the entire population. But for now, the initial target, based on the safety profile of the vaccines, we are targeting approximately 20 million persons. And these persons are health workers, this is based on the segmentation, persons with underlying health conditions, security personnel, other essential service providers, persons above 60 years, students of second and tertiary institutions, teachers at all levels, specialized groups, called the executive, legislature, judiciary, the MDAs, the media, and of course the rest of the population will receive the COVID-19 vaccines. We're going to use a mixed bag of delivery strategies. We use static, that is where we use fixed clinics. There are already existing hospitals, health centers, clinics, both public and private. We'd also conduct outreach services depending on the area, because there will be mobile clinics, temporary mobile clinics, where people go vaccinate and move to the next spot. There will also be camp out. Camp out is usually suited for those colleagues or citizens on the islands and the riverine areas, where health workers pack bag and baggage and go and sleep on the islands for about a week or so, complete the vaccination exercise, and come out. And of course, we will use a combination of these depending on the situation. So the vaccines or vaccination will be expanded to include children and pregnant women as time goes on and as more safety data become available. Yeah, so this slide is giving us the highlights of the target groups and the potential delivery strategies. So for the target groups that we mentioned earlier, depending on the target group, we have designed a potential delivery strategy. So for example, for health workers, there will be fixed sites. For persons 60 years and above, we use a combination. For those with underlying conditions, we also use a combination of fixed sites and outreaches. And the potential vaccination sites are what you see on the right side. So we use a mixed bag of health centers, hospitals, public, private, outreach points, the community pharmacies, the markets, drive-thrus, and even workplaces, depending on the target.
Dr. Kwame Amponsa Achianusa so to aso ka say eye COVID-19 yare san say FDA for ahwehwe magye atum say eyenti no wo fa ehun hia say se na amafo ka say wo benya yarewa bi efri edronim no enye no kre omo hwehwe mu ne kire say wo fa ade a ebeboa wo yie pa afin so fa eye adwuma enti de Ghana for kanina muntungu.
In prioritizing the vaccine choice, we considered several issues. Key amongst them was the vaccine must be safe. It should be efficacious. In other words, it should work. And not just efficacious, because efficacy is when you are talking about ideal conditions. In the under normal conditions or the world conditions, it should also be effective. How is it formulated? Is it liquid or powdered? How easy is it to be stored? What is the cost of the vaccine itself and then the cost of delivery, and how feasible it can be delivered? The availability, and of course, it has to pass regulatory approval. So based on these, we came up with a list. This list, as you say, has multiple vaccines within it. But as I said, one cardinal thing is regulatory approval. And to date, I would say that the FDA has approved AstraZeneca and Sputnik V within the country. So it's passed what we call the emergency use authorization. But of course, we've also considered other vaccines in the pipeline: Moderna, the Pfizer, Sinopharm, and of course Johnson & Johnson, which is a bit far away because the phase 3 is still ongoing. So just a few highlights, because the requirements for regulatory approval of the COVID vaccines has been provided by the FDA. Included within that is a clear pathway to ensure that we monitor safety.
Yeguswa eka COVID-19 semsemi Cmgh TV komontin so kwhwe say Ghana foa omwo ayawa so di COVID-19 hihye ye isu ana
self-protection, right? No, I don't want to make my stretching away. Now, my friend said, so we are right now. What do you think? So we are right. So we are right now.
the Cmgh TV kasebo no AC yenhwe nsem bia edi kasebo yimu akotene penia oda FDA no e dia tudwa se eye COVID-19 eduro eye ade a omahwehwem emu se eye Dr. ye friend Kwame Amponsa achia no susu dia tudwa se eye COVID-19 eduro ne do mani so se Ghana man nyina ebenye bi nanso so enipa 20 million a edikan e no mo sabeka eduro mi amede kasebo ibrɛ mu edi amegye so wan ni Sika Beatrice Upe insama ekoso on my mudia mesra wo say obekọ yen website ewo www.cmonline.com.gh ye Facebook Cmgh TV Instagram Cmgh TV YouTube Cmgh TV and Twitter @Cmgh TV makramo